Welcome back to your daily dose of discovery. Let's unravel today's intriguing question.
Snoring is common during pregnancy, often due to weight gain and increased blood flow causing nasal congestion. However, if accompanied by symptoms like swelling, high blood pressure, or sleep apnea, consult a healthcare professional. To manage snoring, try sleeping on your side, using a humidifier, and keeping your nasal passages clear.
We've quenched today's curiosity, but there's always more to learn. Keep the curiosity alive by subscribing and joining us for our next adventure.